Robertson.
Thank you. Hospital pressures on the Isle of Wight are particularly severe, and part of the way in dealing with so-called corridor care is for the hospital and local authority to look at discharging some frail patients to the mainland, including those living with dementia, which is plainly not a solution in anyone's normal interpretation. Is there anything in this bill, notwithstanding it doesn't deal with the fundamental problems of social care, is there anything in this bill not only that can help resolve those sorts of situations, but could help resolve those situations if they went a little bit further? So I'm looking for opportunities here where we can actually use this bill to try and do a little bit more in and around discharge social care.
Andrew.
It's a very good question to which I don't have a very immediate answer. I do have an immediate answer, which as far as I can see, nothing very substantial. I do think that the single patient record offers some prospects here and something that is terribly important for people receiving social care, which again reflects how much longer we live. There's much more multiple morbidity now. So many of the people who are benefiting from and can benefit from social care will have quite complicated medical experiences and medical histories. And so we really do want, that's the kind of group that could particularly benefit from a single patient record, so that we're not having inappropriate prescription or just, that's going to help. But I don't, that's going to be a second order issue. I think the fundamental issue, if I can let me be very blunt, there are two fundamental challenges facing the social care system. The first is that the means tested bit of it, where we say if you don't have any resource of your own, the state will look after you. That must be a minimum for any humane society. Essentially every year for at least the last decade, the Treasury has announced emergency funding for that in year. That money then doesn't get spent well. And honestly, if you're announcing an emergency package every year for 10 years, it's not an emergency package. You should wake up, pay attention, have a mature response, and fund that system properly. That's the minimum. The second is that the only big risk that we all face that isn't pooled is social care. So our risk of healthcare is pooled by the state. Our risk of having a car accident or our house burning down is pooled by private insurance. This is the one risk that is not pooled. And the reason it's not pooled is the state doesn't and the private sector can't. The reason the private sector can't is it's too far ahead for a private insurance market to deal with it. So only the state can pool the risk. If there's any area where the case for social insurance is absolutely clear, it's social care. It's even more powerful in social care than it is in health. So we have at the moment a situation where often people will feel that the best thing that can happen to them if they think they might have a social care need is that they die before too long. It's a bit like standing in the middle of the road with a lorry driving towards you and you're hoping that the best thing that might happen is that you die before it hits you. Well, that's not a good way to be running any kind of society or country. And those challenges, the lack of adequate funding of the means-tested system and the lack of any risk pooling for the population as a whole, lead directly to the kind of experience that you're describing in the Isle of Wight, where there's simply excess demand for, and so we're then trying to ship people across to the mainland. It's a reflection of the fundamental challenges that we've ignored for 35 years.